Bonjour. This is Bruno Larvol. I'm the founder of the Larvol Group. We're a data and software company in the healthcare pharmaceutical industry. We sell various solutions, many of them in the oncology field. And you're listening to the very first of a new series of podcasts called Larvol Onco Data. I'm joined today, and probably most of these, but not all, with Dr. Mark Gramling, our VP of Oncology. Welcome to the podcast, Mark.
Thank you, Bruno, as always.
Today, we're going to, for this inaugural episode, we're going to focus on a very particular conference that is going to take place starting tonight in San Diego called ASH, American Society of Hematology. I actually am about to head to San Diego in a couple of hours. Lynn Wen, our head of sales, will be there. We'll have a booth. And this is a great opportunity for us to show what kind of magic we can do with data, software, analytics, and a lot of smarts that Mark and his team have injected into the product. That product is called Larvol Clin, CLIN for clinical, because the focus is clinical data. So again, if you're just joining us, we're going to talk about how to use our platform, Larvol Clin, which is available for free for non-commercial use, partially for free. Not all the bells and whistles are there, but mostly for free for non-commercial use. And so what you're listening today, you can use yourself by going to larvolclean.com and be able to access these functionalities. So first, a word on Clin, and then I'm going to ask Mark to share his screen in a few minutes and to show us. We're going to essentially prepare for ASH together and look at the upcoming data and look at the kind of interface, the kind of functions that we have prepared for you to prepare for ASH. Clin, the way I describe Clin is to say our job is to do what clinicaltrials.gov could not finish. Clinicaltrials.gov, as you know, since you're insider in the healthcare industry, is a government-maintained list of all the trials. Their goal was to include the data from the trials, and it's very hard to do. So that's what Mark and his team have done. They take every single published outcome data from every single cancer trial, and they put it in a common data model with great analytics on top. And I always say it's a little bit like painting the Golden Gate Bridge. I'm here in San Francisco. Once you finish curating and entering data one way, you have to go the other way. And it's a never-ending work. So Mark and his team are working extremely hard to curate, enhance that experience on Clin. Anything to add on Clin, Mark? And then I'll leave you give a bit of a quick run through Clin to be used to prepare for ASH.
Sure. I don't think I have any express additions to that. Maybe I'll say, obviously, clinicaltrials.gov is a wonderful resource that so many people use, obviously, in this industry, and it's wonderful unto itself. But sort of what we do is taking everything else that is out there and trying to pull that in together and fulfilling that promise. It's certainly not casting aspersions on ct.gov, which is fantastic. We just have an approach to use our analysts, having a great team, and being able to not only look at historical data, but also surveil and always constantly being able to update the data. And that's especially germane to this conversation about ASH, which is pulling this into Clin. And as you said, if you go to clin.larvol.com, you can't see everything, some of the analytics I'm about to show, but you can check out what we're doing. So that's my secondary commentary. But we can dive in if that's what we'd like to do.
Let's do it.
I'm all in. So let me share my screen in just a moment here.
And by the way, if you are heading to ASH in San Diego, so we'll have a booth there, and I'll be there, as I mentioned. Would love to say hello. Would love to introduce myself or to catch up if we know each other already. I will wear one of my signature caps, so you and obviously, uh, purple is our color.
Fair enough. Well, I would. I'll be at my home office here in Nashville, but I certainly hope you can connect with Lynn and Bruno in San Diego. I have my signature purple hat with me in my office here, and I'm going to go back to my other. So let's maybe dive in, and I hope my screen share is working fine. This is Clint, and we're going to, in the interest of time, obviously just focus in on ASH. You can search for trials, you can find all of the data. We, as Bruno mentioned, put everything into a common data model. So we digitize Kaplan-Meier survival data, also commensurate forest plots, and also non-time to event outcomes data like ORR, CR, and PR. And further, if you look on the right-hand side of the screen, we also have about 3,000 oncologists that we follow on Twitter. So Clin is an all-inclusive platform for all of that type of data. But let's just hone in here on the conference tab. And let's dive right into ASH and sort of just walk through and click through the type of things that we pull into this platform. So I've gone to Clan, I've clicked through into ASH. As you can see here, we're pulling the titles and giving a little bit of additional information from the trials from which those titles come, describing those abstracts, whether they be a poster, whether they be late breaking, whether they be an oral presentation, and you have all of that at your disposal in Clin, and it's just pulling that together. We can also give additional details about the authors and the affiliations. So you can think of it as an on-the-fly type of planning tool. We also, do more complex conference planning tools of all the sessions for ASH, which is a separate product. And if you're interested, you can always check that out or reach out to us about conference planning. But at the top level of it on Clin, that's what you can see there. So we have pulled together in Clin about 1,600 plus abstracts, all of which are linked to trials. Clin is trial centric. So that's what you're seeing here. Now, let me go into the next sort of element of this, which is I referenced earlier that we follow about 3,000 oncologists and experts in the oncology space on Twitter. So what does that mean? So if I dive into a particular title here, you can see that we are not just pulling in and not just in an automated fashion, but with analysts looking at responses on social media, specifically X, the artist formerly known as Twitter. And we're putting all of that together, even with a sentiment analysis. Now, most of these are not rated, they're neutral. But as we go through, perhaps you'd see a positive or a negative reaction to any data release. And we have analysts doing that. And we pull all of that together for every disclosure at ASH. So you can see all of that here. And then, that's a huge part of how we do conference coverage, covering that. But I'll jump ahead maybe to analytics, but maybe before I jump ahead, because I'm obviously being a part of building this product, I get too excited. But maybe I'll pause for any other elements before I go to the analytics, Bruno, that you might ask me about,
And
or
so,
maybe a customer would ask.
well, so I mean, obviously, we don't have every single abstracts for ASH, but we have every abstract that can be linked to a
Yes.
clinical trial, right? And that's how many? It's a little small on the screen for me.
1657 is the
Okay.
precise number.
Right. And now it's a very important link that we're building, and it requires both technology and sometimes actually analysts and train natural language processing tools to make sure that we link every abstract to the correct clinical trial. And okay, and then of course we have for each of these, we have all the details about that clinical trial. We have what we call sometimes a 360 page, or maybe it's worth one click on the clinical trial page. Sometimes we like to create a Wikipedia page. So our goal is that if you take one trial, our job in Clean is to have the ultimate Wikipedia page on that clinical trial. Every published data, every publication, every comment from our panels of 3,000 oncologists on X, every Kaplan-Meier curve, every forest plot data, every hazard ratio, every response data that we can find. We have the thumbnail of the data. You can click on it and get to a full, in some iteration, a full res, but not hosted by us, hosted typically on Twitter. So that's our essentially Wikipedia page for that trial. And so as you prepare for ASH, you have not only obviously the abstract identified and ranked. We'll get to it in a second. The most important abstract, the most discussed abstract are ranked in the analytics that Mark is about to show you, but you're also one click away from that Wikipedia page of each of these clinical trials.
Absolutely. And I did that briefly on the screen, and I'll recapitulate what I did is obviously we're talking about ASH, and that's the premise of what we're discussing today. But I briefly did it, and I'll redo it, is that we have that 360 perspective as Bruno described. So maybe I'll just look here again briefly at this Perseus trial. I hope I'm not mispronouncing that. But you can also explore CLIN in that 360 view as you do here. So just to be quick, to demonstrate is it's also everything in CLIN is not just conference centric, although that's what we're talking about today. If I go to this trial, we also here, just as a representative example, we have multiple publications from the same trial which have been linked. Depending on levels of access, sometimes you can see previews of the information. It's structured slightly differently here. Just give me 1 second. It's structured slightly differently, but you can see the Twitter reactions holistically, where my cursor is here, for everything on that trial. And we also have tools to do related trials. So that's a 360 view that Bruno was referencing. But then maybe let's just dive back in to ASH as well. So I'll emphasize to go into analytics. So hopefully we've well described here how we cover these trials, and you can always reach out to us or these abstracts, how we do that. But I wanted to jump over here, and this isn't publicly available, but with a subscription to CLIN, you would have access to the following. So I'm going to jump over from this icon to some of the analytics to just demonstrate some of the capacity of CLIN in terms of how we collect data. So let me just jump right into that. So what's coming up here first is the top trials as rated by the amount of social media reactions from our 3,000 or so oncologists. And that's how I ended up on that Perseus trial, because it ended up at the top of my screen, because there's a large number of reactions even before, ASH starting today, tomorrow has happened. And our analysts curate this. As I already said, they affix a sentiment analysis if it's positive, not rated or negative. And we pull all of that together, and you can click through this type of analytic to exactly what's being described in terms of how people are reacting to that trial. So it's a interactive analytic to understand. I hate the word chatter. I prefer the word discussion, because discussions happen on X, and that's how they happen these days. So I'll start there. Let me reopen the analytics in just a second here. I might actually refresh my screen for a second. StreamYard and our partners over there. Sometimes it fights me with my browser, but I'm going to re-pull that back up.
As you do that, I'd like to acknowledge Shahir Sheikh, our producer extraordinaire, who is in the background behind the curtain, making sure that everything happens well. Thank you, Shahir, for your great support.
I think I may try to reshare. Just give me 1 second.
The other thing I would say to the listeners is that if you, again, there's a version of this that is free. You don't even need a login. You go to clean.larvol or Larvol Clean, both redirect, and you can access all of that data and many of these analytics. Now, the advanced analytics for ASH are not available with a login. However, if you want to try it for ASH, tell us. Or for the next cancer conference, ASCO GI, ASCO GU, for example, we can unlock them for you to allow you to experience the good work that Mark and team have done.
Absolutely.
I will also be at ASCO GI and ASCO GU, because it's very easy for me in San Francisco. So would love to say hello, and would love to introduce myself if we don't know each other.
Absolutely. And hopefully I've rebooted here. I am doing this in a slightly different window, and just wanted to continue to show the different panels of how we do our analytics. So where we left it off was by trial. So we started there. And again, as Bruno said, reach out to us if you're interested. We'd love to share. We'd love to enable this for you, if this would be a value add for your experience at ASH. So just to keep going, this data is reoriented in a slightly different way. So top influencers, I don't know if I like influencers as my favorite term, but these are obviously influential voices in the field of oncology. So we pulled together the top number of reactions by person in terms of how they're reacting to different data, different trials, different abstract releases at ASH. So that's what you can see here. So these are sort of the social media and social elements of what we do, but also we analyze that data overall for what's coming through ASH and the abstracts coming out. We also analyze it by, I'll call it non-social elements, but other elements here. So what you can see here is we're tracking both with our NLP and our AI, but also with our analysts. What are the top products being presented in terms of number of abstracts at ASH? And you can see that here with the companies as well. And if I were to keep going through the different analytics, we also parse this out by MOA to consolidate those elements of individual drugs and do that by MOA. So here you can see the number of abstracts being presented at ASH by MOA as well. So that's fairly straightforward. This is largely based on our text mining, our NLP, and our AI. And then finally, in the broadest strokes, number of abstracts and presentations by diseases at ASH as well. And then
Actually,
finally, well, I'm going
before,
too fast. And then
yeah, before
finally,
you get
by
there,
top companies. So let's pause there for a second.
let's look again at the ability to compare years and see if we see any interesting patterns of emerging. So go down the long tail to see if there's anything. They seem to be pretty equal here. Okay, no, nothing jump off. But if you go to the previous pages and look at it again by different year, I think there's
Mhm.
some. Okay. So look, oh, yeah, yeah. So there's one that collapsed, right? So uh, people who are very close to the data might understand why, but clearly there's a change in the level of conversation, quite drastic,
Mhm.
on in that dimension. And
Well, this is not expressly conversation. This is number of abstracts.
yes,
So this is actually a pretty dramatic diminution, if you will, here, which is sort of rather remarkable. I can't get into grave detail, but that's what is showing here in comparing with previous years. But just to keep exploring that, let me reload the analytics real quick to see if we can do one more of these
hmm
and to compare with previous years by drug. And I find this interesting. Most of it's fairly sustained, but you could argue that from 2021 to 2023, by mass action, that this Jakafi asset from Novartis and Insight is trending forward at ASH. And of course, Venticlax is always going to have high volumes, but we're seeing higher volumes here. And obviously, as I think I already described, you can click through and then see what that listing of trials that's being referenced in the analytics are. So I appreciate you getting me to pause on that.
sure,
I was just about to do so. The year over year, I think, can create interesting trends. I call this the New Orleans plot because these colors remind me of New Orleans. So that's what we're doing with comparing previous years there. And I think just to round out the point, to keep with time, I think I might have left off one analytics. So we went, I think, where we left it off with top diseases. So that's here. We did that quick comparison. And just to keep moving as well. So we do extract with our NLP or AI who the sponsors are of the abstracts related to trials. And so that's what we're doing here. Again, for ASH, of course, we're all talking about ASH, is how people are reacting to data releases for these sponsor groups. So right now it has both industry and academic. So that's there as well. So this is cycling back into the social element that we started with the reactions and the top reactors. So that's the big fast pass through for the analytics available for ASH. And I'll just conclude to say this is obviously dynamic as ASH starts in San Diego shortly. Our analyst, our team, our tech will be pulling this and updating this in a real time way. This will change. As you could expect, people will be responding differently after they've seen the data live than they did maybe looking at the title releases. So this is a very dynamic analytics for ASH. And that's why if anyone's interested, we'd love to talk with you and give you access to this for this dynamic um, platform. I have that sounded um, almost arrogant. I think it's a beautiful, dynamic platform, but I've been helping to build it, so I'm biased. But I'll pause there, Bruno, to
Go,
see if
go,
there are any things I overlooked. Go.
go back to the top disclosures. So if I go to Ash, my first question before Ash is, which sessions are the most anticipated one? Which one should I go to? And after Ash, I want to know, what did people say, and which of these are going to be the most practice impacting in some ways. And so people haven't started presented. Ash start tonight and tomorrow, but clearly Perseus, Sympatico. Then there's a SWOG. Then there's a ISCA. So another one. Then ITHERA. So these are the top ones. Um, our analysts. So we did not include every tweet, only the ones that are meaningfully commenting or quoting or mentioning a specific trial. So
Correct.
very curated. Our analysts have assigned a sentiment. It's not AI, it's an analyst who did it. It's not perfect, but if you see Perseus clearly, it's a very positive. I don't need to know what they say to know that it it's a phase three that is that is practice changing, and that is very positive. I don't need to read anything to know that. Why? Because it's by large the number one discussed, and nobody said anything negative about it. Yeah. And out of the 130 commentary, our analysts would have picked up a few negative things if it were anything else than the practice changing, how impact clinical trial results.
Mhm.
Right. So as a lazy analyst, consider me. I'm the lazy. I don't have any time. Not lazy, but I'm busy. I can see right away a lot from looking at this analytics. And then on Monday or Tuesday, after all the data has been presented, I can get a fuller picture about what has been discussed. I will have a refined view of the trial that has immersed conversation on X among verified oncologists, and I will be able to get a clearer picture about which of these is really practice impacting. Actually, we're looking at even rating that in the future in our analytics, and taking all these tweets and having our own rating, a little bit the way, I don't know, CNN calls election, right? When it happened, well, CNN called that person won. We probably going to try to say, okay, we called that trial right on Monday, on Tuesday as practice changing. People might say, "Oh, um, don't do that. We're not sure," but that's one of the features, Mark, we're considering, right? We
Yeah,
might have different view about
we're
the
considering you. We're being we're doing the best we can to be creative, but I at least once upon a time used to be a cancer scientist, so sometimes I wonder how to do that, but we're working on it. We're going to try to find a way to leverage that information. Right now it's more, I hate to say choose your own adventure, our, but our construct is to bring all of this to you so that people in the industry can have all of this in one space, and they don't have to do, I hate to say grunt work, but don't have to do all of that ground and pound and grunt work themselves. The idea of Clin is to pull all of this to you so you can see it quickly. You can find it in our analytics for these conferences, um, and make your lives easier in the oncology space.
so obviously it's only the malignant side of hematology. We do not cover
Yes,
the
yes, yes.
non-cancer side of ASH. Huh?
Yes, we're only in the oncology space, so that's a limitation, but that's our focus with the Clin platform.
So,
So
so to our listeners, if you're going to Ash, if you're interested in Ash, it's not too late. Check it out. It's free, no login. And what you should do, if I could recommend that, is to reach out to us. You can do it on social media or through our website, or we'll share here. We'll probably create a bit of a link to Mark here, and ask us for a login and check out how Clin can help you for ASH, and then later on for ASCO GIGU and all of the other conferences that you need to cover for 2024. Thank you.